Hello and welcome back to Patient First Podcast. Today we are going to talk, frankly, about one of my biggest career goals right now to help, I hope, the industry that we love. How we can help patients, how we can help dentists, how we can free ourselves of a prison that I think we've been locked in for far too long in technology, in dentistry. This started basically as a moonshot. I didn't know if this would be something where I would be able to have influence. And I think right now it's going to happen. I think we can make this happen. And so this is kind of a call to arms today. I would love if you are a well meaning dentist to get involved with this cause today. This is a cause that I think we have to take up for our patients, for ourselves, for our industry, where we have been throttled for far too long. In fact, I like to think that we are also in some kind of prison. Now, if you can't read this, if you're listening to the podcast, it's a man with a phone in a prison saying, "I sound funny? Yeah, I'm calling from my cell phone." We are in a cell phone. Our technology is in a prison right now. We have a philosophical wrong going on in our profession that we can do something about. Let me describe what it is. It is our patient's data in our dental records. That's why I have a telephone thing here, because a lot of these companies are using telephones as a way to put you in one of the prisons. But I digress. Our patient's data is legally owned by who? By our patients. We as dental practices are stewards of that data, right? But we don't have access to that data. We have access to it on the terms of our practice management vendors. Same thing with our patients. Good luck as a patient getting access to the data that you legally own. Whether or not you want your patients to have access to the data that you put into their record, that is legally owned by them. And I think it's philosophically wrong that patients and practices do not have that access. This massively affects dental care negatively. It's time to allow for easy, free access to this information to help our patients and to help us help our patients. Just think about a very simple situation that happens to every practice every single day. Maybe not every day, but at least every week, where you have somebody move from across town or even across the street and comes to your practice or goes to another practice, not even across the country, right? How much of the patient's information do you get from the prior dentist? Jack squat. Maybe you're lucky if you get bite wings and a pano, or bite wings, a pano, and a PA, right? And the patient has to fill out all their information again, which, by the way, oh, they love doing that, right? Even with paperless forms, they just love filling out their medical history, their dental history all over again. This is completely moronic. The year right now is 2022, and we can't get our patients' information. Are you kidding me? Our patients don't have access to authenticate different providers. That is completely wrong, and it is, I think, time to fix it. X-rays are a pain, let alone, to get. If the practice that you're getting these X-rays from is in the around 10% of practices that use film, it's complete garbage, right? And it's never timely. It's just a pain. It's just a pain. So we typically expose our patients to more radiation to get more radiographs. Oh, that's really good, right? Let alone getting a treatment plan from the prior dentist, which, by the way, again, this is part of the record, part of the patient's data, insurance information, financial information. I mean, this is go on and on. The paperwork that's involved, and even if you use paperless forms, this should not have to be done. This should be done automatically because we are stewards of this data and it's the patients that own it. Period. I'd love if you disagree with me, comment, subscribe, let me know below, because this is a battle that I think we need to fight for our patients, for our industry. And I am willing and hopeful in taking the charge to make this happen. And I'll tell you how you can get involved in a little bit. But I mean, just think about how important it is to have the history of a tooth in your practice. So if you've been seeing a patient, like I've seen patients for 20 years, and I have in my head this history of what's gone on with that tooth. And that will dramatically affect the future of how I treatment plan. If somebody has a high caries rate history, is that going to affect your treatment plan going forward? Absolutely. If that tooth that you did endo on, that you weren't quite sure what was going on, and you told the patient at that point in time, I don't think if this doesn't work, if there's an issue here, there might be a crack that I saw, so we should extract it versus doing a retreat. Valuable, valuable, valuable information that today does not get past the next dentist. That is wrong. That's a big, big, big problem. If you again, if you disagree with me, please let me know. Why do we limit ourselves? Right? We should have all of our patients' history, including red flags like this tooth had a crack when I did a crown. So if there's an issue, we should go straight to extraction, not do a root canal. Or I mean, I'm that might be a little bit hyperbole, but you understand what I'm saying. If you're a dentist, you see these things when we're seeing patients that historically is significant to the future treatment that we provide. And today, that doesn't get passed along at all. But because it's not available today does not make it any less significant. And the reason why we don't have that access today is because of a bunch of BS with people aren't allowing us access to that information to profit from it. And that is wrong. That's why I'm fired up, because frankly, it's getting worse. You see it, go open up any dental magazine, go to a website, and you'll see, ooh, switch to this platform. That's the one software platform that does it all. Okay, first of all, Apple doesn't have a platform that does it all. Google doesn't. They have these app stores, right? Which so they don't do it all because they can't. And guess what? These companies in dentistry, oh, they can't either. They might do one thing well, but they're not going to do everything well. It doesn't make sense. Also, what they're doing is if you move your data to them, their one system that's probably in the cloud, good luck getting access to that data later on. You're trading a leaky prison for a high security prison. And and that is not right. So beware of these platforms that say they do everything. That's BS. I don't think it's possible. We have a platform, Tooth Apps, where we bring all these different applications together because of this. I'm digressing, but I think it's really dangerous to move your data to the cloud for a one provider solution that says they're going to do everything for you. Good luck getting access, having your patients get access to that data. I think we can break that open, and I'll tell you how in a little bit. So they're just trying to lure you into their little fiefdom, into their castle with a gigantic moat, so you can't get access to the data. And it's easier to do this in the cloud than it is on your server, because your server, that data is sitting in your office, you can get access to it. That's not true in the cloud. So make sure that whoever you go to, ask them, how easy is it to switch from your system, your one platform that does everything, to the next platform that does everything? If they can't give you good information, if they say, why would you ever leave? Why would you ever go? Okay, why would you ever go there in the first place? It's a roach motel for your patient's information that won't come out, right? That is not good for you. And many, many, many of you watching this today are thinking, well, I have this old practice management system that I had for 20 years, and I need to switch. At some point, I'm going to have to do something. But when I switch, what I'm most worried about is the conversion. How easy is it going to be to convert from this practice management software solution to that one? Why? Why is it hard? This is the patient's data. This is your data. Why is this hard, right? Well, let's standardize it. Let's make it so that everybody's information is meant to flow in the same direction. I help lead the development of a new standard development company called a standard development organization. It's called an SDO. That's ANSI accredited, called Dental Standards Institute. You can go to dentalstandardsinstitute.com. I also work with the ADA, their SCDI on standard development, which is a I think there's been some new leadership there, and they're doing great things, particularly with the integration with medicine and dentistry. So the ADA also does great work with standards, and I think, and I'm doing work with them too. But particularly what Dental Standards Institute is focused on is two things: removing the barriers that choke innovation. And that's one of the ones that we're talking about today. Locking our data up chokes innovation, because let's face it, if you're in this big platform and they have thousands and thousands of offices with their data there, how much are they going to actually innovate and create new solutions, right? If you're bringing a new platform that does something great to dentistry today, it is difficult because you can't get access to these fiefdoms that some people have built. So let's crack it open. If you go to our website, again, dentalstandardsinstitute.com, you can see the 4 ANSI accredited standards that we have implemented already, that we've published. We're working on a bunch now in this area. There's some great things we're doing with some great partners, not partners, who are members of Dental Standards Institute, that around insurance verification and getting transparency around pricing. But my personal goal right now is to open up so that our patients have access to the data that they own, and practices have access to the data that we are stewards of. Okay. Again, this is a hot topic for me, and I'm happy to debate it with whoever would like to. If you feel differently, if you feel on board, I would love to hear your comments. Reach out to me if you want to be involved. Again, just go to dentalstandardsinstitute.com. Everybody's welcome to come to our meetings. We're virtual. We're developing work groups right now to address these issues I'm talking about today, and I would love to have you involved. Thank you very much, and I look forward to seeing you next week on the Patient First Podcast.